Imagine waking up one morning feeling weak, tired and short of breath. You tell yourself it is just part of getting older. You ignore it and continue your daily routine. Days pass, weeks pass, months pass. The weakness grows stronger. Walking becomes harder. Sleeping becomes uncomfortable. But you keep saying it's nothing serious. Then, one day, your body suddenly gives up.
At the hospital, the doctor looks at you and says, "If only you had come earlier." Doctor, if only you had come earlier.
If you are over 60, this video could protect your life. Many seniors miss the early warning signs of heart failure because they seem small at first. But these silent signals can become deadly. Today, I will share 5 dangerous signs that most older adults ignore until it is too late. Stay with me until the end, because the final warning may save your life or the life of someone you love. Heart disease remains one of the leading causes of death around the world, and the risk increases greatly after the age of 60. As we grow older, our bodies change, and many seniors begin to accept weakness, fatigue, and discomfort as normal. They say, "I'm just tired." This is part of aging. Everyone my age feels like this. But the truth is, aging should not take away your breath, your strength, or your independence. Growing older does not mean growing helpless. It does not mean living in pain or fear. Many serious heart problems begin quietly, with small signs that are easy to ignore. By the time strong symptoms appear, serious damage may already be done. Doctors agree that early detection and early action can save lives. Simple medical checks, small lifestyle changes, and timely treatment can prevent major emergencies. But when people delay, hoping the problem will disappear, the consequences can be tragic. Too many seniors lose their health, mobility, and confidence because they waited too long to listen to their bodies. Some lose the ability to walk freely. Some become dependent on others. Some lose years of life that could have been enjoyed with family and loved ones. This channel exists to change that story. It exists to educate, empower, and protect you. Our mission is to give you clear, honest, and practical information so you can make wise decisions about your health. You deserve to live strong, active, and independent for as long as possible. And that journey begins with understanding why your heart matters and how to care for it today. When many people hear the words heart failure, they think it means the heart has completely stopped. But that is not what it means. Heart failure happens when the heart becomes too weak or too stiff to pump enough blood to meet the body's needs. Your heart is like the engine of your body. It works every second, day and night, sending oxygen and nutrients to your brain, muscles, and organs. When your heart is healthy, you feel energetic, clear-minded, and strong. But when it begins to weaken, your entire body starts to suffer. With heart failure, blood does not flow properly. As a result, oxygen levels drop, waste builds up, and fluid begins to collect in the lungs, legs, and other parts of the body. This is why people with heart problems often feel tired, short of breath, swollen, or dizzy. One of the most dangerous things about heart failure is that it develops slowly. It may take months or even years before serious symptoms appear. During this time, many seniors believe they are simply slowing down. They adjust their lives, rest more, walk less, and avoid activities they once enjoyed without realizing their heart is struggling. Heart failure can be caused by high blood pressure, diabetes, blocked arteries, past heart attacks, poor diet, lack of exercise, smoking, stress, and untreated medical conditions. In many cases, it is preventable or manageable when caught early. The good news is this: Heart failure does not have to control your life. With proper care, healthy habits and early treatment, many people live full, active and meaningful lives for years. The key is understanding what is happening inside your body and taking action before it becomes too serious. Sign number 5, constant fatigue. Feeling tired once in a while is normal, especially as you grow older. But constant unexplained fatigue is not normal. If you feel exhausted even after resting, sleeping well, or doing very little activity, your heart may be sending you an important warning. When your heart is weak, it cannot pump enough oxygen-rich blood to your body. Your muscles, brain and organs begin to suffer. As a result, even simple tasks like walking to the kitchen, climbing a few steps, or getting dressed can feel overwhelming. Many seniors ignore this sign. They say, "I'm just getting old. My body isn't what it used to be." Everyone my age feels tired. But this way of thinking can be dangerous. Aging should not leave you feeling drained every day. Pay close attention if you notice that you are sleeping more than usual but still feel weak. If you wake up tired, struggle to finish simple chores, or lose interest in activities you once enjoyed, it may not be laziness or depression. It could be your heart working overtime just to keep you alive. Some people also notice mental fatigue. They feel confused, forgetful, or unable to concentrate. This happens because the brain is not receiving enough oxygen. Over time, this can affect memory, decision-making, and emotional balance. Constant fatigue is often one of the earliest signs of heart failure. It appears quietly and slowly, which is why so many people miss it. But if you listen to your body early, you give yourself a chance to get help before serious damage occurs. If you have been feeling unusually tired for weeks or months, do not ignore it. Talk to a doctor. Get checked. Protect your strength, your independence, and your future. Your energy is a gift, and it is worth defending. Sign number 4, shortness of breath. Shortness of breath is one of the most common and dangerous warning signs of heart problems after 60. Many seniors notice they become breathless while walking, climbing stairs, bending down, or even talking. At first, it seems small. You pause for a moment, catch your breath, and move on. But over time, it gets worse. When your heart is weak, it cannot pump blood efficiently. This causes fluid to build up in the lungs, making it harder for oxygen to move into your bloodstream. As a result, you feel like you cannot get enough air, even when you are resting. Some people notice they feel breathless when lying flat in bed. They may need extra pillows to sleep comfortably, or wake up suddenly at night, gasping for air. Others feel tightness in the chest, or a heavy feeling when breathing. These are serious signs that should never be ignored. Many seniors dismiss these symptoms. They say, "I'm out of shape. It's because I gained weight. It's just old age." But breathing should not feel like hard work. Struggling for air is not a normal part of aging. Shortness of breath limits your freedom. It stops you from enjoying walks, visiting friends, doing housework, and living independently. Over time, it can lead to fear, anxiety, and isolation. If you notice that simple activities now leave you gasping, or if your breathing has changed suddenly, it is time to take action. Do not wait. Speak to a doctor. Get your heart and lungs checked. Early treatment can prevent serious complications. Your breath is life. Protect it, listen to it, and never ignore it when it starts to change. If this video is helping you, please subscribe. We share life-saving health tips for seniors every week. Sign number 3, swelling in the legs, feet and ankles. Have you noticed that your shoes feel tighter than usual? That your socks leave deep marks on your ankles? That your feet look puffy or swollen at the end of the day? Many seniors experience this and think it is harmless. But swelling in the lower body can be a serious sign that your heart is struggling. When the heart becomes weak, it cannot pump blood efficiently. This causes blood to slow down and back up in the veins. As pressure builds, fluid leaks into nearby tissues, especially in the legs, ankles and feet. This condition is called edema. At first, the swelling may appear only in the evening and disappear by morning. Over time, it may become constant. Your legs may feel heavy, tight or uncomfortable. Walking may become painful. Your skin may look shiny or stretched. Pressing your finger into the swollen area may leave a dent that stays for several seconds. Many people blame this problem on standing too long, hot weather, arthritis or weight gain. While these can sometimes cause swelling, heart-related swelling is different. It often appears in both legs, gets worse over time, and does not fully go away with rest. Swelling can also spread to the stomach and lower back, causing bloating, discomfort and sudden weight gain. This happens when your body begins storing excess fluid. Ignoring swelling can lead to serious complications, including skin infections, poor circulation and worsening heart failure. The earlier you take action, the better your chances of protecting your health. If you notice persistent swelling in your legs, feet or ankles, do not dismiss it. Talk to a doctor. Get tested. Your body is asking for help. Listening now could save your mobility, your independence and your life. Sign number 2. Rapid weight gain and fluid retention. Many seniors feel happy when they gain a little weight, thinking it means they are eating well and staying strong. But sudden, unexplained weight gain can be a dangerous sign that your body is holding on to excess fluid because your heart is not working properly. When the heart becomes weak, it struggles to pump blood efficiently. This causes the kidneys to receive less blood. In response, the kidneys begin to retain salt and water, thinking that the body is dehydrated. As a result, fluid builds up inside your tissues and organs. This extra fluid can collect in your legs, feet, stomach, lungs, and even around your heart. Over time, it causes swelling, bloating, and discomfort. You may notice that your clothes feel tighter, your belt no longer fits, or your stomach appears swollen even when you are not eating more. One of the clearest warning signs is gaining 2 to 5 pounds within a few days without changing your diet. This is not normal weight gain. It is water weight, and it can appear quickly and silently. Many people ignore this sign. They say, "I must be eating too much. It's just my metabolism slowing down." But this kind of weight gain is not caused by food. It is caused by fluid overload, which puts dangerous pressure on your heart and lungs. Fluid retention can make breathing harder, worsen fatigue, and increase the risk of hospitalization. If left untreated, it can lead to serious complications. If you notice sudden weight gain, bloating, or unusual swelling, start paying attention. Weigh yourself regularly. Keep a simple record. And if the numbers rise quickly, talk to a doctor immediately. Your body keeps records even when you don't. Listening to those numbers can help protect your life. Sign number 1. Irregular heartbeat and chest discomfort. Have you ever felt your heart suddenly racing, pounding, fluttering, or skipping beats? Maybe it feels like your chest is trembling inside. Maybe your heartbeat becomes fast for no clear reason, even when you are resting. Many seniors experience this and brush it off. But these sensations can be serious warning signs. When your heart is weak or damaged, its electrical system may stop working properly. This can cause abnormal heart rhythms, also called arrhythmias. Instead of beating in a steady, healthy pattern, your heart may beat too fast, too slow, or unevenly. This reduces the amount of blood reaching your brain and body. As a result, you may feel dizzy, lightheaded, weak, anxious, or confused. Some people feel sudden fatigue. Others feel like they might faint. These symptoms can come and go, making them easy to ignore. Chest discomfort is another dangerous sign. It does not always feel like sharp pain. Sometimes it feels like pressure, tightness, burning, heaviness, or squeezing. It may spread to the shoulders, arms, neck, jaw, or back. Some seniors mistake this for indigestion, gas, or muscle pain. But chest discomfort combined with irregular heartbeat should never be ignored. It may signal reduced blood flow to the heart or an increased risk of heart attack and heart failure. Many people delay seeking help because they do not want to bother anyone or go to the hospital. But waiting can be deadly. Early treatment can prevent permanent damage. If you notice unusual heart rhythms, chest pressure, or repeated dizziness, seek medical help immediately. Your heart is speaking to you. Listen carefully. Acting quickly could save your life. What to do if you notice these signs? Noticing one or more of these warning signs does not mean you should panic, but it does mean you must take action. Ignoring symptoms is one of the biggest mistakes many seniors make. Hoping they will disappear on their own can cost you precious time, health, and even your life. The first step is awareness. Pay attention to your body every day. Notice changes in your energy, breathing, weight, swelling, heartbeat, and sleep. Your body sends signals long before a crisis happens. Learning to recognize them gives you power. The second step is documentation. Keep a simple health record. Write down when symptoms appear, how often they happen, and how strong they feel. Record your weight, blood pressure if possible, and daily activity. This information helps doctors understand what is happening inside your body. The third step is medical evaluation. Do not rely on guesswork or internet advice alone. Visit a qualified healthcare provider. Ask for heart checkups, blood tests, and necessary scans. Early diagnosis can prevent major emergencies and reduce long-term damage. The fourth step is lifestyle correction. Small daily habits have a big impact on heart health. Eat balanced meals with less salt, sugar, and processed food. Drink enough water. Walk or exercise gently as advised. Get enough sleep. Manage stress. Avoid smoking and excessive alcohol. These changes strengthen your heart over time. The fifth step is medication discipline. If your doctor prescribes medicine, take it exactly as directed. Do not skip doses. Do not stop suddenly. Many heart-related complications happen because people stop treatment too early. The sixth step is emotional support. Do not face health challenges alone. Talk to family members, share concerns with trusted friends, join support groups if available. A strong emotional network improves recovery and motivation. The final step is emergency awareness. Learn the signs of serious danger, severe chest pain, sudden collapse, extreme shortness of breath, confusion, or loss of consciousness. If these happen, seek emergency help immediately. Do not delay. Your health is your responsibility. No one will protect it more than you. Taking action today can give you many more years of independence, joy, and meaningful living. If you remember only one thing from this video, let it be this. Your life is valuable, and your health is worth protecting. Growing older does not mean giving up on strength, happiness, or independence. It means becoming wiser about how you care for yourself. Your heart works every second to keep you alive. It deserves your attention, respect, and care. The signs you learn today are not meant to scare you. They are meant to empower you. If this video helped you, share it with someone you love. It may save their life. Subscribe to this channel for more trusted guidance on healthy aging, strength, and longevity. And most importantly, promise yourself today that you will listen to your body and act early. Your best years are not behind you. With wisdom and care, they can still be ahead of you.